Hey everyone, this is Jeff Somerville here with Tom Kern. We are excited today to be giving you a trailer really of a demonstration that we have that's going to show the power of combining Veeva CRM data with IQVIA prescription data in order to show how we can change the prescribing habits of HCPs based on the prescribed interactions that our Salesforce should be taking. So without further ado, this is going to start with Tom, who is a brand manager over a drug called Astracept, a product that we're selling. And this is how his morning started. Take
Thanks,
it
Jeff.
away, Tom.
Cheers. So, as the brand manager for Astrocept, I like to start my morning just checking out the metrics that mean the most to me around our new product launch. So, I like that I can see in one view my total prescriptions to date for Astrocept, around 75 million. I like to keep track of my new prescription percentage. In general, we've seen a bit of growth. I also like to keep track of my market share versus my competitors. Now, again, I've seen some growth over recent weeks, but I do see a decline in the last week. So I want to keep track of this. I'm going to send a note to my friend Jeff here and say, hey, can we look at this, please? So with that, I will send it back over to Jeff.
So I just received a Slack message from Tom. I am the North American sales manager for Astracept. And what I want to do here is see if I can look into what might be causing some of these changes and figure out how we can drive market share for Astracept. So this dashboard is really looking at a couple of different things. What I have is my sales reps over here on the left. I've got their activity, what kind of prescriptions are being written. I have my HCPs here in the middle, and then over here I have my channel activity. I'm going to dive right in and pick on Julia Dunbar. Julia is one of my favorite sales reps here. And what we want to do is I want to try to figure out if there's something I could tell Julia that she should do differently with her HCPs in order to improve market share in her patch. One of the things that I see right away here is that there's a considerable difference between Dr. Waldorf and Dr. DiBattista. They both have very similar size of revenue. However, Dr. DiBattista has a significantly lower new prescription rate than Dr. Waldorf. And new prescription rate is a proxy of market share. So let's see if we can figure out if there's a difference between Robert and Nick. Let's look at Nick first. Down here at the bottom, what I see is that there are emails that are being sent, video conferences and phone calls. I know that there's WebExes and peer-reviewed articles, conference trade shows being shared, and I get a good view of the activity that's been going on. Let's look at Dr. Waldorf to see if there's a distinct difference. And really, the distribution of emails to conferences to phone calls and what content was shared doesn't seem to be much different. So I'm at a loss right now as to what I could tell Julia that she's doing well with Robert that she should be doing with Nick. So let's take another look into market share to see if there's something there, to see if it's a geographic thing. And what I can see is that for Julia, she has a pretty high market share as compared to our competitor compounds. However, I still want to drive that number to be better and better. And what I see here is that Connecticut, New Jersey, and New York all seem to have the same thing, are very similar numbers. So I'm not sure where to go. So I think what I'd like to do is I'd like to pass it off to my analyst team and one of our business scientists who Tom's going to be playing, who might be able to take all of the data that we have from both IQVIA and Veeva and put it together to create a model. So Tom, if you could, why don't you go ahead and show us how that might be done?
Sure. So one of the things that I've loved about Tableau for a long time is that we can really do a lot of data exploration, start to ask and answer several questions right in the flow of analytics. But now with TCRM, we have the capability to build predictions on top of that as well. Now, everything we saw so far, we could use Tableau's relationship model to be able to look at these different data sources without pre-joining them. But for building a model, I do want to do some data prep. So I'm just showing you quick the prep flow that is used to do that. I brought in my IQVIA data, my physician demographics, and my outreach data. I've built a market share target metric, and I've also aggregated some historical information. How many webinars have been sent over the last 6 months? How many phone calls have been made in the last 2 months? What is the most recent contact type? Once I have that data with a target and all my historical metrics that influence the target, I'm going to send it off to TCRM. Now here in TCRM, I've uploaded my RX model data set, and building a model is as simple as creating a story. I tell TCRM that I want to maximize my market share. I choose that I want both insights and predictions, and I'll let TCRM choose which variables are most important. Now, this is only going to take a couple minutes to produce a model for me, but when it's done, I'll get a view like this. I'll be able to see certain insights about what variables are most important in predicting that market share. But very importantly, I'm going to be able to see the actual model built behind the scenes. How accurate is that model? What can we do to improve that model? And then when we're ready, let's deploy the model. Now, I want to do two things with the model in this case. I want to both save it to an object on Salesforce, so it's right there at the hands of my end users, my sales reps, when they're in Salesforce every day. And I'm also going to send it off to my Tableau team. So the first example there, I'm going to attach it to my Salesforce object. So here I'm looking at Dr. Nick DiBitetto's account. I've got my Einstein predictions. As a result, I see what the predicted market share is for Dr. DiBitetto, both what makes up that top prediction and how to improve this prediction further. I also have the ability to put in that overall account dashboard so I can see how Nick fits in with the greater picture. So this is great. I've been able to build a model with just a handful of clicks. I put it right here where it's going to drive behavior, but now I want to drive home the so what. Why are we doing this? And for that, I'm going to send it back to my Tableau analyst team to incorporate this in an aggregate view. So Jeff, please take it away.
So we're going to take that dashboard and figure out how can we take this dashboard that we see with Julia Dunbar and integrate the model that Tom just created. Well, what I want to do real quick is show you inside of Tableau how easy it is now in order to bring a model that was created in Einstein Discovery for Tableau. What we do is simply bring a dashboard extension onto a dashboard. This is our new extension gallery now built directly into our tool. And all I need to do is search for Einstein. I'm going to select that plugin or that extension. And what you're going to see here is with a few steps in configuration, I can now bring that model directly into Tableau. So here is our model, our maximize market share over 6-month review. I want to attach that to the worksheet with the worksheet that's here. The next step is going to be to map all of the fields that are being leveraged in the model to the fields that are within the worksheet. Finally, I'm going to go ahead and just see what we got here. And I'm going to click done. And what we see is now I've got a model of the data that was on the sheet being passed back to Einstein Discovery, and the results are now here to share. Let's take that a step further. We work with this a little bit more, and what we end up with is a very intuitive, actually let me jump over here, very intuitive dashboard that's now going to allow me, the manager, to interact with Julia and talk to her about what are the things that she could be doing. So let's jump over and let's select our good friend Nick DiBitetto. What I see here is that Nick has a current market share of 13.3%. However, Einstein is predicting that he could be as high as 31.3%. And what I see in the screen right here are some suggestions on what Julia should be doing in order to improve Nick's ability to prescribe Astrocept over our competitor drugs. And here it's saying increase the frequency of the interactions and send fewer emails. Well, what this is telling me is that we need to have some more physical and in-person communication with Dr. DiPotetto. That perhaps we've sent too many emails, and that's why we're not getting the response that we want. Well, let's see if let's look at another physician and see if it says the same thing. Nope. There's actually 4 other reasons, or new reasons, or specific things of the things that we should be doing for Justin. Invite the physician to more webinars, offer additional peer-reviewed articles, conduct more in-person video conferences. So this is a unique prescription. And let's look at Sean. Again, uh, different prescriptions that Julia should be following. Now, this is great. And what if Julia is ready to go visit Sean? Well, what we can do here is I can go and click on my driving directions, and it's going to jump out to Google Maps. And in this case, for the sake of this demo, we're assuming that we're starting from Salesforce Tower in downtown New York, in Manhattan. And here are the driving directions. It's 15 minutes away. But let's jump back into our analysis. So she goes and she talks to Sean, and she talks to Justin, and she talks to Nick. What does that mean? So incrementally on the way, that's where things over time start building more and more impact. And what we're seeing here is that if Julia were able to get every single physician to follow some of the steps that she could prescribe to help them improve their the amount of prescriptions that are being written for Astrocept, that she could improve her incremental revenue by $520,000. Well, Julia is only one sales rep of many. And if we look at this analysis, just for Astrocept, for this example, that one person talking to a single physician to make one incremental change has a potential value of nearly $10 million of improvement. Hopefully this has been a great demo that you've seen and can take some of that and use it for your own business practices. If you have any questions, please reach out to Tom and I. We're more than happy to answer it. And thank you very much for your time. Have a great day, everyone.